North America and Europe are our main venues.
Okay. Right, don't forget to keep texting in. That number is 86686, that's 86686. Type the word EDGE, E-D-G-E, leave a space, give us your name and message. We'll be collecting some more of your thoughts after this break. But don't forget, now's the time to sign up online.
Alex G own another suit.
Ah! Well, thank you very much. As you might know, I own plenty of shirts, but the suits I wear are all black. You put a black suit against that, and I look like something from Itsy and Bitsy, and if you remember that, you're showing your age. Okay, lots of questions now about amalgam fillings. This seems to be the hot topic, as it were. So, how do you tell that mercury has been used in your teeth? Is it just the colour? Is there any particular way of knowing without seeing a dentist and asking him?
Well, really, you look at they're called silver fillings for a good reason. They appear silver or black in the mouth. So you just have a look and see what looks silver or what's black, and that by and large will be an amalgam.
I mean, that's the first thing that immediately occurs to me. The aesthetics of these is appalling. You know, they don't look good in the mouth. So that seems on a very basic level that people should consider something else, surely.
Well, yes, but you have to go back into history. See, amalgam turned dentistry from a cottage industry for the very rich where only gold was used into a mass, multi-million-dollar, billion-dollar industry that it is today. It created dentistry for the masses that just wasn't there before. And so no one was concerned in the beginning, 150 years ago, about the aesthetics. Aesthetics consideration is really a fairly modern phenomenon. And anyway, it's only used in the back teeth, and most people don't really examine their back teeth to such a degree.
When we're talking about the sort of cosmetic look of teeth, that immediately made me think of image 101, which is basically, this is an orthodontic picture regarding straightening teeth. So can you talk us through what we've got here?
Hi, this is a photograph we use from the book, because basically we say people can be damaged by dentistry through either the materials they use through toxicity, or through infection, which is another toxicity, or through the actual structure. And this is structural damage. If you look, it's especially pronounced on the lower jaw. This is somebody who as a child had 4 premolar teeth removed, 1 on every quadrant, 2 on the bottom jaw, and you can see what's happened. The premolar teeth have come out, and the teeth behind them have then tilted forward, and as they have tilted forward, so the angle then that the teeth have to work with is different than the angle that the jaw work with. They become out of harmony. Once they become out of harmony, then the muscles get into trismus, and then the teeth can crack. You have chronic headaches, and the whole thing, you can have terrible problems.
And this is basically what happens when people are subjected to this regime of having the braces around the teeth and then
extraction orthodontics, yes, does cause that problem. There are ways where you don't do it. That's the traditional way it's always taught. There has been battles on this line too between the conventional and non-conventional dentist over many years.
Right, right. So, back to our amalgam fillings and the question, what are the symptoms? How do you know that you're being affected by the mercury release?
There isn't a single symptom that you can say. It's not like you have an amalgam filling and if the mercury comes out then you'll break into purple spots. There are a multitude of symptoms. It's a poisoning, so it's a whole syndrome. It could be anything at all, from a neurological complaint, it could be allergies, it could be multiple chemical sensitivity. Chronic fatigue is another classic one, or even reduced thyroid function, and heart disease. This
gets back to what you were saying. It's very much on a case-by-case basis that you actually have to sort of look in to the whole patient and what they've been doing in their life. We had the mention, oh yes, still on the amalgam side of things, should people get their amalgam fillings replaced? How